Good morning, Mr. Winslow. My name is Lakin. I'm going to be your student nurse today. We're going to do a head-to-toe assessment. Are you okay with that?
Yeah.
Do you know what that is?
Yeah.
Do you have any questions before we get started?
No.
Okay, I'm just going to pull this curtain for privacy. And can I just check your name and date of birth?
Joey Winslow, 5/7/1991.
Perfect. Okay, so first thing I'm going to do is check for situational safety, make sure there's no lines, drains, anything in the way. Next thing I'm going to do is I'm going to clean my stethoscope. I'm going to clean my pen light before we get started. And then I'm going to note patient's grooming and hygiene. And it looks like he takes care of himself very well. How's your mood been lately? Are you anxious or depressed at all?
No.
Any thoughts of suicide?
No.
Are you safe at home?
Yeah.
Perfect. Okay. And then next we're going to move on to neurological. How's your sleep been lately?
Great.
Any dizziness or headaches at all?
No.
Okay. So patient reports no dizziness, no headaches. And I'm just going to ask you a series of questions. What is your name again?
Joey Winslow.
Okay. Do you know where you are today?
At the hospital.
Okay. Do you know what we're doing today?
Yes.
What do we do?
Head to toe assessment.
Okay. Perfect. And then do you know what date and time it is?
It's 5 o'clock, 11:15:21.
Perfect. Okay. And then how did you get here today?
I walked.
All right. All right. So first thing I'm going to do is I'm going to check your eyes. So I'm going to shine a pen light into your eyes and I'm going to cover one side. So just take. Perfect. Okay. And then this side. Great. So pupils are equal, round, reactive to light and accommodation. Next thing I'm going to do is I'm going to test your hand grasp. So if you can just grip my hands. Perfect. All right. So he has good grasp strength in his hands, and I'm going to test your resistance against mine. If you can put your arms out and push up against me, perfect, and then pull down against me. Same thing with your legs, push up and pull back. Perfect. All right, so resistance in upper and lower extremities is good. Next, we're going to check your ears, your nose, your throat, and your head. I'm going to wash my hands and put some gloves on. Are you okay if I touch your scalp?
Yes.
All right. Let me know if you feel any pain or any discomfort, any tenderness.
No.
Nothing, okay. I don't see any lesions, any irritation, any bumps or bruises. Nothing was painful, nothing was tender. So I do notice some balding pattern here. Is that run in your family?
Yes.
Okay, so patient reports that does run in his family. Next, I'm gonna just check your sclera and your conjunctiva and have you do some eye movements for me. So, looks like his sclera and his conjunctiva, his sclera is white, his conjunctiva is nice and pink and moist. Any discharge that you've had at all?
No.
Okay, perfect. All right, so I just want you to keep your head straight and your neck straight and just follow my pen with your eyes. Perfect, awesome. Okay, so eye movement is good. Next thing I'm gonna test is I'm just gonna check inside your ear. So I'm gonna shine this light in your ear and look and just make sure. Nice and pink and moist, no irritation. I'm gonna do this side as well. Nice and pink and moist. No irritation on that side either. Any pain in your ears or tenderness?
No.
Okay, and can you hear this?
Yes.
Okay, and then can you hear this?
Yes.
Good. Okay, so patient's ears are very healthy. So now I'm just going to check the sinuses. I'm going to tap your forehead and underneath your eyes just to see if there's any tenderness, okay?
Okay.
Any tenderness here?
No.
How about right here?
No.
Perfect. Okay, so sinuses are good. Now I'm just going to have you tilt your head back. I'm going to look inside your nose. All right. No deviated septum. Nice and pink and moist. No issues. Any painful irritation, redness, or painful or tenderness inside your nose?
No.
Okay, perfect. All right, so now I'm just going to check inside your mouth. And I'm just going to also look at dentation. Can you say ah? Perfect. No redness, no irritation. Any surgeries to remove any teeth at all?
No.
All right, and so there's no cracks in the teeth. Everything looked good with the teeth, no sores inside the mouth. Patient reports no pain inside his mouth. So now we're just going to move on to respiratory. So do you have any trouble breathing?
No.
Any shortness of breath or tightness
No.
in your chest? All right. So overall skin color, for the sake of this video, we're going to keep his shirt on, but overall skin color looks good. I'm just going to feel your chest. Let me know if you have any pain at all.
Nothing.
No pain?
No.
All right. And I'm going to feel the back side. Any pain here?
No.
All right. All right, so I'm just going to clean my stethoscope. I'm going to wash my hands and put gloves on. And I'm just going to listen to your breathing for one full inhalation and exhalation at each site. So just breathe like normal. So again, one full inhalation and exhalation, and I'm going to listen bilaterally. And I'm going to listen anteriorly, and I'm also going to listen laterally. And then I'm going to have you turn sideways in your chair, and I'm going to also listen posteriorly to each side, one full inhalation and exhalation bilaterally. And laterally on the back side as well. All right, and everything sounds good. I don't hear any wheezes, bronchi, any crackles, anything in the lungs. And then his AP to T ratio is 2 to 1, so that is normal. Can I just feel your trachea?
Yeah.
Okay, any problems with swallowing, drinking, or eating?
No.
Nothing? Okay. Perfect, and no pain there?
No.
All right, so patient reports no pain with his trachea at all. He does swallow just fine. All right, and then I'm just going to move on to the musculoskeletal system. And so we're gonna check your strength in your shoulders and your neck. So can you shrug for me? Perfect. Okay, and then push against me this way, and backwards. Perfect, and forward. Great. So patient has good strength in his shoulders and his neck. And then now I'm just gonna check range of motion in his upper and lower extremities. So if you wanna stand up for me, I'm gonna have you put your arms out, and then in, and then arms in front of you, and elbows or palms facing up and towards you, okay? And then arms behind you, great. And then same thing with your legs. We're gonna put your leg out and your leg in, or I'm sorry, backward. Okay, and then to the side, and same thing with the other side. Forward, backward, and to the side. All right, and then while I have you standing, I'm gonna have you take a few steps forward and turn around and come back, and a few steps back. So I was just assessing patient's gait, and patient walks just fine. I'm gonna have you turn sideways, the other way. Perfect. Okay, and then I'm gonna have you, I'm gonna have you bend over and touch your toes, and I'm gonna assess the curvature of your spine. So curvature is good, no lordosis, kyphosis, or scoliosis. You can stand back up. Okay, gait was good, and the range of motion also was good. So you can take a seat again. Now I'm gonna listen to your cardiac system. So have you ever had any chest pain at all?
No.
No chest pain? Okay. Do you take any medications for chest
No.
issue, or for heart issues, I mean? Okay, and then now I'm gonna check, I'm gonna clean my stethoscope, put sanitizer on, gloves on again, and then I'm gonna listen to your heart here. So I'm gonna listen to the aortic, and I'm gonna listen for a full beat cycle, so a lub and a dub. And then the pulmonic, I'm gonna listen to the Erb's point. I'm gonna listen to tricuspid, and I'm gonna listen to the mitral. And then I'm also going to listen to the apical pulse for a full 60 seconds, which is also the pulse point of maximum impact. Everything sounds good. I don't hear any abnormal heart sounds, and the heart sounds nice and strong. Next, we are gonna move on to the peripheral circulation. So I'm just gonna check your radial pulses bilaterally, and I would feel these for a full 60 seconds. Good, nice and strong. Now I'm gonna listen to your pedal pulses for a full 60 seconds. Good, nice and strong. No issues with radial or pedal pulses. I'm gonna check the capillary refill of your fingers. So I'm gonna just check that every finger, make sure it's less than 3 seconds, which is normal for capillary refill. All right, and then I would check the same thing on the toes. So I would check each toe for capillary refill for, make sure it's less than 3 seconds, which would be normal, and all is good. With the patient, everything seems normal. While I'm doing that, I'm also gonna be assessing the temperature of the skin and making sure that he's nice and warm. I'm also gonna be looking at the color of the skin, make sure there's no pallor, no cyanosis, and no jaundice. And everything looked good with temperature as well as with color. Next, we're gonna move on to the GI system. So do you have any abdominal pain?
No.
Okay, and then any appetite changes recently?
No.
Okay, when was your last bowel movement?
5 hours ago.
And is that pretty normal for you?
Sure.
How many times do you go a day?
Twice.
And that's normal?
Sure.
Okay. All right. And then any problems with urination or discharge or odor that you're concerned about?
No.
Okay, any problems with your genital area at all?
No.
Okay. And then also this is where I would inspect the abdomen just by looking and make sure it's nice and flat and soft and there's nothing protruding that I can see and everything looks good from inspection. I'm going to auscultate the bowel sounds and I'm going to auscultate all 4 quadrants for a full 3 minutes to make sure bowel sounds sound normal. So again, I am going to wash my hands, I'm going to put gloves on, and I'm going to clean my stethoscope. And I would normally have my patient be laying down for this. So I'm just going to listen to all 4 quadrants for a full 3 minutes. And everything sounds nice and normal. I don't hear any abnormal sounds. Patient doesn't have any issues with his bowel movements. Do you have any nausea, vomiting, diarrhea, or constipation lately?
No.
Okay. All right, and then next we would move on to palpating the abdomen. So I'm just going to put my hands and push on your belly, okay? Tell me if it's tender or painful.
Neither.
Nothing so far?
No.
All right, so perfect. Patient reports no pain, no tenderness. I didn't feel any masses while I was inspecting. I also didn't see any redness. I didn't see any irritation, lesions, or wounds. So all is normal with the abdomen. Next, I would do a I would visually look at the genitals and make sure there is no lesions, wounds, redness, irritation. Everything seems normal there. So now we're just going to move on to the skin. So any itching, irritation of your skin at all?
No.
Okay. And then any issues with wounds, lesions, moles?
No.
That you're aware of? Okay. So I would just note any scars, rashes, lesions, wounds, moles that I see. Also, I'm going to note the moisture of the skin. It is nice and dry. There's no diaphoresis. It's nice and pink and warm to the touch. It is not hot, so it's not feverish. And it's, like I said, it doesn't have any color changes like pallor, cyanosis, or jaundice. Then I would just check the turgor on the back of the hand to make sure the patient is not dehydrated and he has good turgor, so no dehydration. Let me check on this side. Perfect. All right, so no dehydration at all. Turgor is normal. So it concludes our head to toe assessment. Do you have any questions for me?
No, I do not.
Okay, perfect. Now I'm just going to make sure the bed is back down low in a safe position. Give him his call light and just let him know that if he needs anything to holler at me and I will come back in.